Welcome everyone to another wonderful episode here at Doctors of Podiatry. Upcoming case, we have a young patient who has presented to our office for the first time today seeking long-term solutions for the left foot bunion, which the patient has been battling for the last 20 years or so. Yes, 20. We had a very long talk today about the difference between the open traditional versus the MIS, the minimally invasive surgical approach. And just to name a few again, some of the differences that we were talking about, incision, the traditional, right? Let's just compare quickly. Traditional, you have the big incision, the MIS, one stitch, one stitch, one stitch, what we kind of call the trifecta approach. We're talking specifically now, the bunionectomy, the bunion. Number two, definitely the post-procedural pain, right? There's, when there's more dissection, there's clearly more discomfort after the procedure. When you do things through these tiny little keyholes, there's less trauma. Less trauma means less pain. Number three, no screws, no pins. Very important. Number four, and let me just say this, what people fail to realize is, and this is really important, the screws, and I know because I used to do the open traditional approach many moons ago, the screws play one single role, whether it's a pin or a screw. It's to hold the bone in place while the bone is healing. Once the bone heals, the screw plays no purpose whatsoever. Okay, so Dr. Wagner, does that mean that after 3 or 4 months that screw or the two screws can come out? Absolutely. But people don't, people always think that, oh no, the screws they need to stay there because they need to continue to hold the bone in place. That's not the case. Very important. A lot of people don't know that. And same thing goes for like an ankle fracture when they use plates and screws. Yes, they serve a purpose while the bone is healing. After that, they play no purpose whatsoever. The patient is very excited. But nonetheless, we spoke about the incision, we spoke about the post-procedural discomfort, walking, ambulation. The patient can actually walk right after, the day of. And that's really, really important to, in respect to comparing that to the open tradition. There's some, depending on the surgeon, some doctors don't want their patients walking immediately. Again, not all doctors are created equal. Okay, so, the patient presented to our office with two major chief complaints. Number one, obviously, the bunion. What we're going to go ahead and do is perform a minimally invasive bunionectomy. And basically, again, 3 parts to the procedure. Number one, we perform, this is the bump, right? The bunion. We want to make sure that we're able to, first of all, shave this off. Number one. Number two, we make a little cut in the bone here. And number three, we want to make sure that the toe is straight. So basically, again, we'll try this again. That's exactly, this is exactly, what we're trying to achieve, right? And that's what we will achieve. It's going to look absolutely beautiful. Number one. Number two, let's look at the right foot. So the right foot, the third toe is deviating, that way, right? Laterally. So what we're going to go ahead and do is, again, one little stitch here. It's a soft tissue procedure, and we're going to go ahead and we're going to, realign the toe kind of like there. Okay. It's going to also look really, really pretty. The patient is, these bunionectomies that we perform, especially in this case, this has been affecting the patient's daily life activities. There's nothing aesthetic about this. Yes, the aesthetic elements do follow, right? I mean, does it look pretty now? Not necessarily, right? But after we accomplish this, it's going to look really pretty. So, whether it's something related to function, which is obviously pain, elimination of pain, the aesthetic elements also do follow, which is kind of like the nice thing. This is great. We continue to pioneer, the minimally invasive anesthetic foot and ankle surgical procedures here at Doctors of Podiatry. The bunionectomies I truly love, just because, especially in a case as such where it's not just mild. It's kind of like between, you will say, moderate and severe. The X-rays, definitely, when you look at the X-rays, you see how bad the structural deformity really is. And we're not going to really talk about the causes of bunions. I would definitely Google that. But the most important thing is that we continue to educate the world that minimally invasive anesthetic foot and ankle surgery does exist. It definitely does. And we continue to have not only patients from all walks of life, but patients from all around the world that are flying and coming to see us here at Doctors of Podiatry for this, which I think speaks volumes. For all you guys, especially whether it's Instagram or YouTube, if you guys know of anyone that is battling suffering, that is looking for solutions, if they have a bunion or hammer toe, anything, a toe that is looking, north, south, east, or west, who knows? Let them know to follow us on our Instagram page, Doctors of Podiatry. There are solutions out there, minimally invasive solutions. For all this, the non-subscribers, definitely subscribe to our YouTube channel, Doctors of Podiatry. And again, we will, comments are welcome, please. And as always, we will continue to educate the world one foot and one toe at a time. Have a wonderful day, everyone.